Theraflu Expressmax Cold-Cough is a combination medication used to temporarily treat symptoms such as cough, stuffy nose, body aches, fever, headache, and sore throat caused by the common cold, flu, or other breathing illnesses like sinusitis and bronchitis. It contains dextromethorphan, a cough suppressant that reduces the urge to cough, decongestants to relieve stuffy nose symptoms, and acetaminophen, a non-aspirin pain reliever and fever reducer. It is important to note that this medication is not intended for ongoing coughs from smoking, asthma, or other long-term breathing problems, or for coughs with a lot of mucus, unless directed by a doctor. Theraflu Expressmax Cold-Cough is not recommended for use in children younger than 6 years, and some forms of the medication are not recommended for use in children younger than 12 years. It is important to follow all dosage directions carefully to decrease the risk of serious side effects. It should not be used to make a child sleepy, and other cough and cold medications with similar ingredients should not be used at the same time. It is recommended to consult a doctor or pharmacist for other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. When taking Theraflu Expressmax Cold-Cough, it's important to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. You can take this medication with or without food, and it can also be taken with food or milk if it upsets your stomach. If you're using the liquid form, be sure to measure your prescribed dose accurately using a medication measuring device or spoon. Do not use a household spoon. If the liquid form is a suspension, remember to shake the bottle well before each dose. If you're taking the chewable form, be sure to chew thoroughly before swallowing. The dosage is based on your age, so it's important not to increase your dose or take this medication more often than directed without your doctor's approval. Misusing this medication may result in serious harm. If your condition lasts for more than 1 week, gets worse, or occurs with a persistent headache, rash, or fever, it's important to consult a doctor as these may be symptoms of a serious medical problem. Some common side effects of Theraflu Expressmax Cold-Cough include dizziness, drowsiness, headache, nausea, nervousness, and trouble sleeping. If any of these effects persist or worsen, consult your doctor or pharmacist. Your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, shaking, weakness, or problems urinating. Seek medical help right away if you experience very serious side effects, such as chest pain or fast/irregular heartbeat. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Acetaminophen is one of the ingredients in Theraflu Expressmax Cold-Cough. It's important to not take more than 4,000 milligrams, 4 grams, of acetaminophen a day, as it can cause serious liver disease. If you have liver problems or are a child, you should take less acetaminophen. Be sure to check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you're not sure. It's also important to avoid alcohol while taking this medication, as daily alcohol use, especially when combined with acetaminophen, may damage your liver. If you take too much acetaminophen and experience symptoms like nausea, vomiting, or yellowing eyes/skin, seek medical help right away. And remember, it's always best to ask your doctor or pharmacist how much acetaminophen is safe for you to take. Before taking this medication, it's important to let your doctor or pharmacist know if you have any allergies, as Theraflu Expressmax Cold-Cough may contain ingredients that could cause allergic reactions. You should also inform them of your medical history, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, overactive thyroid, or trouble urinating. It's also important to avoid driving or using machinery after taking this medication, as it may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit these substances in your diet, make sure to speak with your doctor or pharmacist about using this product safely. Additionally, older adults may be more sensitive to the side effects of this drug, and pregnant or breastfeeding women should consult with their doctor before using this medication. It is important to be aware that this medication may interact with other drugs and cause potentially serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without consulting your doctor. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. It is also important to be cautious of other products that may interact with this drug, such as ketoconazole, levodopa, and rolapitant. Additionally, the ingredients in this product are available in many prescription and non-prescription products, so make sure to check the labels on all your medications carefully. It is also important to inform your doctor or pharmacist if you are taking other products that may cause drowsiness. Furthermore, this medication may interfere with certain urine lab tests, potentially causing false results. Make sure to inform lab personnel and your doctors that you are using this drug. If someone has taken too much Theraflu Expressmax Cold-Cough and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can contact a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes or skin, dark urine, agitation, confusion, hallucinations, and seizures. Remember to always follow the recommended dosage and seek medical help if you have taken too much. Make sure to keep all of your medical and lab appointments to monitor your progress or check for any side effects. This will help make sure the medication is working properly and is safe for you to use. If you have been instructed by your doctor to take this medication regularly and you happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it's best to skip the missed dose and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. It's important to stick to the recommended dosage and timing to ensure the medication works effectively. Make sure to store Theraflu Expressmax Cold-Cough as directed on the package label, and keep it away from light and moisture. It's important to not store it in the bathroom. If you have any questions about storage, you can ask your pharmacist. Remember to keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.